So we are now recording, and thank you very much. Happy Wednesday, everyone. It's lunchtime now, and we're going to be beginning our webinar on maintaining optimal bladder health in MS. I'd like to, my name is Amanda Rose, and I'm the National Manager at Multiple Sclerosis New Zealand. And with me is Louise McKinley, who is our Communications Lead here at MSNZ. We're excited today to introduce Dr. Daniela Aldabe and Toni Thomas, who is a physio student at the University of Otago. Daniela is one of the leading lecturers at the University of Otago in physiotherapy and with a particular interest in bladder health. We are very excited to have them come speak to you today as we are working with them on some resources around bladder and bowel health. And this is a bit of a learning exercise from our side to gain some information from you, as well as helping to provide you with some useful tips and tools of how to optimize and maintain your own bladder health with MS. I'm going to hand over right now to Daniela. Thank you.
Thank you. Thank you so much all for coming to our webinar. We really hope that you are going to enjoy and taking some good advice from us. So just a little introduction from me. So I'm from Brazil, as you can hear on my accent. I'm from the south part of Brazil, Rio Grande do Sul, that blue area over there. I'm a pelvic health physio, and I'm also very interested in neurorehabilitation. So I teach both topics here at the Physio School. And my area of research is also linking bladder health and neurological disorders. I am a mom of two wonderful children, Lucas and Clarissa, and also a fur baby, Pickles. And this is Toni.
Hi, so I'm Toni. I would consider myself a mature physiotherapy student, as I feel I'm older than the general demographic here at Otago Uni. So prior to that, prior to becoming a student, I spent a lot of time overseas traveling around, and I actually worked on this particular cruise ship for about 3 years. I was part of the entertainment and performing cast, and then made my way to physiotherapy. Outside of physio, I particularly enjoy aerial silks, a strange hobby, but a lot of fun. You can see me and my silk partner pictured there. And then I'm also a mum just to a chocolate Labrador, and we like to spend our time on the beach here in Dunedin. I'm a local, so we get out and about. Yeah, so that's just a wee bit about me.
Thank you, Toni. So what are the aims of this webinar, guys? So this is going to be an informative summary around healthy bladder function. Of course, we don't have the time to go through all the aspects of bladder function, but we are going to summarize a few good information for you. Common bladder symptoms that people with MS may experience, lifestyle behaviors changes that contribute to healthy bladder and bowel function. So tips of about things that you can do, practical things that you can do to improve your bladder function and bowel function as well. The importance of pelvic floor muscle training to help bladder symptoms, and some tips on how to train your pelvic floor. But very important, this is not, this session does not intend to diagnose or treat anyone or any particular condition, because that would be unethical of us. Yeah, because we really need to have a one-to-one conversation for this to happen. So this is really an informative session about how to take care of your bladder in a general term. There will be some time for questions and open discussions at the end. So, as I said before, a brief summary how the urinary system works. So, urine is formed in the kidneys. Here is the male system, and here is the female system, and flows via the ureters to be stored at the bladder. So, here is the bladder in the male system and the female system. Urine is then emptied via the urethra, which is here in the male system and here in the female system. And it's very important for us to understand that the bladder is a muscular bag that expands to hold urine and contracts to expel the urine. So the bladder communicates with the brain when it's ready to void, when we are ready to pee. And that communication sometimes can be disturbed if you have a neurological disorder. We're going to talk about that later. For urination, you need the bladder to contract, yeah? And we need the pelvic floor, which is this structure here, to relax. Because as you can see, the pelvic floor crosses through the urethra. So if the pelvic floor is too contracted and it's not relaxing, there is no way, there is no passage for the urine to pass. So we need to have a contraction of the bladder associated with the relaxation of the pelvic floor. And then we should be able to void. Sometimes in some people, there might be problems associated with the pelvic floor or the bladder, meaning that the pelvic floor can be too weak or unable to relax. And sometimes the bladder is contracting too much or is contracting too little. And sometimes people experience both problems. The problem when the pelvic floor is either has too much contraction or too little contraction, associated with too much contraction from the bladder or too little contraction from the bladder. So as you can see here, it's a very complex problem. So that's why we don't do diagnosis in a group format, because it is a case-by-case situation associating the symptoms that people are feeling with where the mechanism is coming from. So why bladder health is so important? Because it will give you long-term kidney health. It can prevent urinary infection or kidney infection. It is very important for personal independence. And of course, self-confidence and overall quality of life is highly associated with healthy bladder. So a few facts about the bladder that is really important for us to understand and just contrast with the things that we are experiencing. So just think about how your bladder is functioning in comparison to these facts that I'm going to tell you right now. So a normal bladder can comfortably hold up to 400 to 500 milliliters of urine. That means that, for example, this bottle of water here that I have in my hand, that is, bigger than my cup, has 500 milliliters. So we should be able to hold this much water inside our bladder. That during the day, we are supposed to go to the toilet for voiding around 5 to 6 times, and no more once than overnight. Yeah, so that means that I should be able to keep without voiding for every 3 hours. So I should be able to hold my urine for 3 hours. So that's a normal function of the bladder. Of course, if you drink too much, and if you drink too much for a short period of time, these facts about bladder function will change slightly. But overall, that's how much we should be able to hold and for how long we should be able to hold. We should not leak, so we should be able to contract our pelvic floor and have a very good sensation about holding our urine and not leaking. The urge to urinate should not be so strong that you cannot get to the toilet in time. So when I have the first feeling that I need to go to the toilet, usually the first feeling is associated to half of our bladder capacity. So around 200 to 300 milliliters is when we have that first feeling. We should be able to hold, yeah? If we are not able to hold, if the feeling it's no longer a feeling, is this urgency or the urge to go to the toilet, especially if we leak, then we have a problem. We should be able to empty completely, leaving no residual urine, or we say that no residual is not completely true, like a 50 milliliters is okay, yeah, so leaving a little bit is fine, but not much. and no dribble or need to return to toilet immediately. So as soon as I leave the toilet, I shouldn't be feeling that feeling or urgency to go back and void one more time. So these are bladder function facts that we usually need to compare because these are the normal functional aspects of bladder. With multiple sclerosis, some people will feel some bladder issues. So, and why does that happen? So MS can disturb the normal communication pathways between the brain and the bladder or bowel. So if you take a look here to this figure, so this is the bladder, and within the bladder's walls, we have a muscle called the detrusor muscle. So this muscle here has receptors that send signals to the brain. The brain recognizes those signals, and those signals should be, oh, it's halfway through full, or it's too full, I really need to go to the toilet right now, and etc. And goes back, so the signal goes back, and what the signal does is the signal contracts your bladder, but also this all happens in conjunction with the urethral sphincters that also send signal to the brain and goes back to the urethra and the pelvic floor. So in a nutshell, as you can appreciate, the bladder, the internal and the external sphincters of the urethra, and the pelvic floor are three independent structures that are regulated by the brain, that they need to work together. They need to work in synergy, yeah? Sometimes with MS, because of the lesion in particular areas of the brain, that synergy doesn't happen, or the pelvic floor is unable to contract, or is contracting too much, or the detrusor muscle of the bladder is contracting too much, or unable to contract, or unable to feel that the bladder is filling in. So there are a mixture, it's a very complex situation. There is a mixture of feelings and symptoms that can be separate or in conjunction. So can this whole thing that I just explained to you, can result in symptoms such as urinary incontinence, so leakage, urination too often, or we call this frequency, increase the urge to urinate, and leakage. Sorry, there is a double up there. If you look at it into the literature, some studies say 19, and some studies say that 80% of people with MS will can present with some sort of bladder problems. And that variation is because of the methodological aspects of the studies, the people that they are interviewing or they are surveying. So as much as there is a variety of motor and sensory systems symptoms associated to MS, there will be a variety of symptoms that affected people in terms of bladder as well. What we all know is that if you are feeling any type of bladder issue, that will impact your quality of life big time. We really need to start talking about it and reporting this to our healthcare professionals. Just one note here, the bladder symptoms that you might be feeling may not be associated to brain issues, yeah? So as much as 19 to 80% of people with MS can present with some bladder problems, some of the bladder problems can be associated to, you know, childbirth, can be associated to menopause, prostate cancer, with aging. So there are other factors that can contribute to bladder issues, pelvic floor issues, or bladder issues that are not associated to MS. So common bladder symptoms associated to MS. So let's go through what you can be feeling right now. So overactive bladder. So if you feel that urge to go to the toilet, it's a feeling that you really cannot hold, you have to go right now, you probably are experiencing some symptoms associated to overactive bladder. It's when the bladder muscle contracts too much when it's not supposed to contract, when the bladder is not completely full. Yeah. So there are two types of overactive bladder. People may just feel the urge to go to the toilet, which can be quite inconvenient, but is still able to hold the urine within the bladder, or sometimes you will leak. So we call this overactive bladder dry or overactive bladder wet. Yeah. There is another symptom which is not associated, but sometimes they go hand to hand, is the frequency. So urinary frequency. You need to pass urine several times during the day, so more than 5 to 6. So I've seen patients that go to the toilet 20, 25 times a day. And sometimes the frequency, it's not only during the day, it's also during the night, which can be quite complicated because disturbs the sleeping pattern. And we know how important sleep is for brain hygiene. So if you are waking up more than once to go to the toilet, that's definitely a problem, and we shouldn't be experience that. So nocturia, we call that nocturia. There is another symptom that is associated to overflow incontinence. So it's when urine may trickle out continually, or when you are doing some bending, coughing, sneezing, as the bladder is overfull. So overflow incontinence happens when the bladder muscle is too lazy to contract, so it's not contracting too much, or when we no longer have the feeling to perceive through the brain, we no longer have the feeling to perceive that our bladder is too full. So the brain doesn't recognize that, and the bladder keeps feeling to the point that it can no longer hold. Then you have that overflow incontinence that happens, for example, when you bend over. Another very common, not only within a mass population, but outside, is the stress incontinence. Stress incontinence is when you have this leakage associated to coughing, laughing, sneezing, and running. So stress is a physical stress. So in 100% of the time, this is associated with a pelvic floor being too weak. Yeah. And lastly, the functional incontinence. So the incontinence happens, the leakage happens because there is a reduced mobility capacity to go and find a toilet in time and void in time. So it's more related to cognitive or motor issues or sensory issues that will prevent us to get into toilet in time. So what is the problem? The problem is most of people think it is normal to live with those symptoms. It's either because I have MS, so I have a bladder problem that's perceived as normal. Health professionals usually don't ask about it and don't talk about it, and that is reported in the literature over and over and over again. And I've been talking to my patients, and they are experiencing that as well. Many people suffer in silence due to shame and embarrassment. So people really are not willing to talk about bladder and bowel problems to healthcare professionals or any people, as a matter of fact. And many people don't want to burden their healthcare professionals with that, because especially if you think that you have so many issues going on, you place the bladder and the bowel issue in the bottom of the priority. Yeah. But what we can say about those problems is bladder issues are very common, but they are not normal. Yeah. It is not normal to go to the toilet 14 times during the day. It's not normal waking up more than once during the night, and etc. It's not normal to leak, and etc. So if you are experiencing something like that, you have to contact a trained healthcare professional. It can be your GP, continence nurses, physiotherapists. Those healthcare professionals should be able to refer to you to a professional or treat the symptoms accordingly. Yeah. We need to start talking and normalizing bladder and bowel issues. So what usually people do when they are facing bladder problems? And we call those negative lifestyle strategies. So usually people, they start drinking less water or just drinking less overall because they think that if I drink less, I will go less to the toilet, I will decrease frequency, urinary frequency. The problem is it increases urinary frequency because if you don't drink a lot of water, or at least the normal amount, which is 1.5 to 2 liters per day, your urine will become more concentrate, and that will irritate your bladder. And by irritating your bladder, your muscle, you perceive that as an attack and will contract more. So you will end up going more and more to the toilet. So this is a negative strategy that people usually do. Another strategy is that I will go to the toilet now, so I won't have the urgency to go it later. So I'm just gonna go just in case. The just in case strategies very rarely is a good strategy. Most often is a very bad strategy because what we are doing a bad bladder training. We are telling our bladder that just a little bit of urine inside it should be contract. Yeah, so we need to do the opposite. We need to train our bladder to fill as much as possible, not to the point that overflows, of course, but to fill as much as possible. And then I have that sensation and then I'll fully empty my bladder. Another negative strategy is I will avoid doing physical activities that are important to me because I'm leaking too much or I need to stop every 10 minutes, whatever I'm doing. And we know that the less physical activity, the poor the bladder behavior will be. Yeah. So not only that physical activity is important for all of us, but especially if we are presenting with MS, we know that certain levels of physical activity will actually improve the fatigue symptoms, will improve motor and sensory symptoms, and it's very, very important for you overall, but also for bladder health. And finally, people start avoiding socializing and doing things that they love, and that will impact in their emotional aspect of life. So what are the recommendations? And here again, because this is a group setting, I need to talk very broadly in terms of lifestyle modification. So I'm going to touch in terms of fluid management, diet changes, bowel management, weight management, and smoking cessation. So in terms of fluid management, what we recommend for people is apart from people that have some sort of issues that are not recommended to have those type of liquid intake, very rarely that happens. Overall, we should be drinking 6 to 8 glasses of water per day. Yeah. If you want to be very picky, you can do a little math. So you can multiply 24 by your weight. And then you're going to have exactly the amount of water that you should be intaking per day. Decrease or stop liquid intake 3 to 4 hours before bedtime. Just this to avoid nocturia. Yeah. So if you are waking up too much during the night, more than once during the night, you should be not be drinking anything 3 hours to 4 hours before bedtime. This is extremely important. But then you need to think about if you are stopping drinking 3 hours before bedtime, you need to think about how you are going to drink those 6 to 8 glasses of water during your wake time. Yeah, discounting those 3 to 4 hours. We usually recommend avoiding high volume intake at once. So have a bottle and sip throughout the day. It's if you are experiencing frequency and nocturia, it is important to keep hydrated, and I'll explain it why. So it's important to keep a record of how much you are drinking. So have a bottle and know how much of water has inside that bottle, so you can monitor throughout the day. Another thing that you can do is avoiding routines. So you can start training your bladder. If you go several times during the day, you can start training your bladder so you can space out the between voiding times. And one of the things that we do for that is bladder training. And one of the things that we do is how to manage the urge wave. So if you are one of these people that experience urgency incontinence or just the urgency, there is this technique that has been proved to be effective, that as soon as you feel the urge, you have to wait a little bit, just wait, and then you have to squeeze your pelvic floor, Usually we say squeeze your pelvic floor 5 times. So you have the urge to go to the toilet, you stop whatever you are doing, you contract your pelvic floor 5 times, and then you wait a little bit, and then you digress a little bit. You just have a little bit of distraction. You can look on your phone, whatever distracts you, you can think about something, you can sing a song. People usually go to their phones, Instagram, whatever, they send messages. And then they wait 5 minutes and then they go to the toilet, just so they expand a little bit that window of voiding between voiding times. That's very, very important, especially if you go too frequently to the toilet. So the bladder training can start as long as 5 minutes. So you do the urge wave technique, and then you can wait for 5 minutes, you can wait, and then you expand that time up to 3 to 4 hours, which is the ideal in between voiding time, most of the time, people can manage the bladder training on their own, but if you are struggling with it, you need to seek a healthcare professional that might be able to help you with this technique a little bit more. So key here are 2 things. You need to know how to contract your pelvic floor, and you need to find something that distracts you, So the pelvic floor contraction, we are going to touch on that topic later in this webinar. Diet changes. So we know that there are a few bladder irritants, and the most common one is, unfortunately, caffeine. So if you're experiencing a lot of urinary frequency and urgency, it is important to decrease or even to stop the bladder irritants during consumption that you are having daily, and especially stopping 3 to 4 hours before the bedtime if you experience nocturia, as I said before. So, so drinks such as coffee, hot chocolate, green tea, black tea, and etc. They have high concentration of caffeine. That is a very important bladder irritant. Other substances are here, like fizzy drink, acid fruits, spicy foods, alcohol, and tomato-based products. Apart from caffeine, which is a very well-known bladder irritant, those other substances, for some people they are, for some people they are not. So it's a matter of figuring out which ones are the ones that increase the bladder frequency for you, you cannot imagine how much changes in terms of bladder function those diet changes will impact. It is very, very important to take a look at the amount of bladder irritant drinking consumptions you guys are taking if you're experiencing that, because it will change your bladder function. Another important thing is the bowel management. So constipation, which can be a common problem in MS, will impact your bladder function because a rectum loaded with hard stools can put pressure on the bladder, preventing it from emptying. The other thing that it does, if you are sitting in the toilet and bearing down, straining for a long period of time, that can increase the pressure over the pelvic floor, and the pelvic floor will not function so well if you are doing that constantly. So impacts on the pelvic floor as well. So 2 things that we need to keep in mind is we need to keep a constipation control and management going on for a good bladder functioning. So think about the type of diet that you are taking. Is it high in protein or is it high in fiber? So we know that if you're taking a more protein type of diet, that will decrease your bowel movement. More fiber type, you increase your bowel movement. So it is very, very important to take a look at your type, the type of your diet. Positioning is very, very important. So here, this figure is very self-explanatory. So if you can keep a small stool in there, just so you increase the angle of your hip in relation to your trunk, that positioning right there will relax your pelvic floor and will increase the bowel movement significantly. That positioning helps a lot of patients, and I would highly recommend that positioning for you, even if you don't experience slow bowel movements. Time, it is important to take your time, but not to stay too long in that position, because again, that position can strain the pelvic floor too much. So try to go to the toilet for bowel movement when you are feeling that sensation quite strongly, then you are not going to strain or bear down too much for a long period of time. Exercise is extremely effective for bowel movement. So keep moving, walking and doing your gardening, whatever type of activity that it's, movement-based type of activity will improve bowel movements, and abdominal massage as well improves bowel movement. Weight management and smoking cessation is important for bladder health, especially if you are experiencing urinary incontinence. So both decreasing your weight and stopping smoking are going to improve, are risk factors, very well-known risk factors that impact urinary incontinence. So now we are going to touch based on pelvic floor muscle exercises, and Toni will let you know how to improve pelvic floor muscle exercises and how to implement that in your life.
Okay, so I understand we've heard this word pelvic floor so much already. So what I'm going to touch on really is what it is and why we're talking about it. So the reason we are talking about the pelvic floor muscles, because what you've heard already is that there's that big link between the pelvic floor underneath and the bladder on top. These 2 groups of muscles do communicate with each other, and there are things that we can do to really help just notice that pelvic floor. So we're just going to start by watching just a short video that explains the pelvic floor a little better than I can, and really gives you a visual idea of what we're looking at when we're talking about this group of muscles as such.
The pelvic floor is the base of the group of muscles referred to as your core. These muscles are located in your pelvis and stretch like a hammock from the pubic bone at the front to the tailbone at the back, and from side to side. They support the bladder, bowel and uterus, and play an important role in bladder and bowel control and sexual function. If your pelvic floor muscles don't work well, you may leak when you do things like coughing, sneezing, lifting, laughing, or exercising. To stop this from happening, you need to switch on your pelvic floor muscles. To switch on the pelvic floor muscles, you need to squeeze and draw in the muscles around your vagina, as if you are trying to stop the flow of urine. Lift them up inside. Breathe normally. Don't hold your breath or tighten your buttocks. Then let go and relax the pelvic floor muscles completely. Notice as you tighten and lift your pelvic floor muscles. They tighten and close around the anal passage, vagina, and urethra. By exercising the pelvic floor regularly, you will train your muscles to work automatically when they are needed.
Okay, so I do just want to acknowledge the fact that yes, we were looking at particularly recognising the female pelvic floor, but just to note that the pelvic floor muscles are the same in a male as well, and they do work the same way. So I apologise that that video was specifically focused on females. And now just recognising why the pelvic floor training is important. So we have already talked about how it can help improve your bladder symptoms because of that link between the pelvic floor and the bladder. It's effective in preventing and treating stress urinary incontinence. We do have great evidence for this, so that incontinence where you may leak when you're coughing, laughing, sneezing, that kind of thing. It can help treat that urge and frequency symptoms that you may be experiencing. And the pelvic floor muscle training, it can also help relax your pelvic floor. So today we're not focusing greatly on that pelvic floor relaxation. We recognize that sometimes the pelvic floor can be overactive or contracting a little too much. So we're not speaking directly to that symptom today. However, by strengthening or increasing sensation to your pelvic floor, working it can also help you notice when it is relaxing. So it does sort of work in parallel as well. Okay, so just going into a little bit of training here. It's often noted people saying I cannot feel or I cannot contract my pelvic floor. So we do have a couple of really simple techniques that can just help you allude to what the pelvic floor is, where it is, and how to feel it. So the first one being mental imagery, having a thought about the pelvic floor, getting the brain involved. We then look at how we can increase sensation, that feeling of the pelvic floor. Another thing I'll talk briefly about is holding your pee when you're voiding or urinating. Now, just using this as a technique to increase sensation. This isn't a treatment technique, and I'll come back to this a little bit later. And then there's also things that we can do to help increase that sensation, or what we can do when we're working the pelvic floor is we can change position. So I'll talk about that a little bit more as well. Okay, so that first one, creating a mental image. So there's a big link between the brain and the muscles, obviously. We need to think about a muscle working from that brain first before it's going to contract for us. So having that picture of the pelvic floor like we've seen in the video in your mind, it's nice to think of this as that hammock, that bowl underneath you that really is holding those organs in place for you, the bladder, the bowel, etc. And that when it contracts, like we've seen in the video, it squeezes upwards. So it's drawing in and up when it's really switching on for you, okay? So just thinking about that, really having that in the front of your mind, maybe when you're trying to do some pelvic floor exercises, which I'll talk through. And then the second technique, that improves sensation. You're thinking, okay, I still can't feel it. I've got that idea of what it is in my mind. What else can we do? So just knowing exactly where that pelvic floor is. We know it now. So touching yourself, for example, taking your hands to your hip bones, drawing them inwards and slightly down. We've got the front of our pelvis here, that bony bit in the front. Now this is where that pelvic floor contracts. It's right at the front of that hammock. So we know that that's there. You can always come back to that feeling if you need to. And then different positions that we can go into. So say a Swiss ball, a soft seat, or particularly sitting on the corner of a seat. If you're rocking your hips slightly back and forward and back, you can really start to feel and notice that hammock underneath you, in between the legs there, the groin area, and just start to think about that as that muscle for you. That's really where we are in the body. And then another way of improving that sensation is holding your pee. So like I said before, we're just doing this to feel that pelvic floor switch on for us. So when you're voiding, urinating, if we're just squeezing slightly to stop that stream of urine and then relaxing, allowing it to flow again. So that stop of the stream is that pelvic floor switching on or really contracting for you to stop it, and then you're relaxing. Now, just doing this very rarely, occasionally, just to increase that sensation if you need to. And then we can also change positions. If you're still not feeling anything, you might like to get down on the floor, take away gravity to see if you can feel that hugging up sensation underneath. Or we can use positions here when we're doing those exercises just to change the effect a little and feel it in different ways. So that might just be in a sitting position, might be leaning up against the wall, things like that. So we can use it for increasing sensation or when we're doing our exercises, that lift and squeeze, which I'll talk through. Okay, so saying now we can feel it, for example, or you know where we are in the body, you know you can feel what we're trying to do. So we're talking about the pelvic floor contracting, okay? So what we're going to do to exercise that muscle. So our contraction first is we're just going to try and squeeze on that muscle as hard as you can. Now that squeeze, you're still thinking, what are we doing? A nice visual is a marble or something really tiny, a blueberry, and in those muscles, we're trying to grip onto it and draw it slightly upwards. So it's that in and up kind of hug-in sensation, okay, between the legs. So if we were going to exercise this, we would aim for 10 repetitions as hard as you can, okay? So we're building that strength through the muscle, or just as many times as you can feel it. So drawing in, upwards, that gentle slight squeeze as many times as you can. Then after that, we want to work on the endurance of the muscle. So we switch it on, we draw in, and we hold here, okay? So ideally holding for 10 seconds or as long as you can feel it. Then you relax, okay? And it's nice just to keep the number that you get to in your mind. So when you come back to it later, you're trying to just maybe get a little bit further. If you felt 3 times, maybe you can feel 4 times. If you could hold for 5 seconds, maybe you can hold for 6. And then like any muscle, we can exercise it. We can try and increase and improve that strength and sensation by doing these exercises every day, just when you can. All right. And then knowing here that we can pair our pelvic floor exercises with other exercises that we're doing every day. It doesn't have to be this major event that you have to try and include. If you're getting on the floor and you're doing a few bridges, working on those glutes, we can think about that hugging up sensation of the pelvic floor muscles as well. When we're sitting on the floor, maybe doing some stretches, we can maybe add in a few pelvic floor squeezes in there as well, okay? Doesn't have to be a big event. It's just trying to pair it with something else that you're doing with movement throughout the day. Okay, so just coming back to a few of those key messages that we've mentioned. I know it's a bunch of information, but just alluding back to some important things here, that the bladder symptoms that we are experiencing, they're very common, but they're not normal, okay? There are little changes that we can make and people we can see that we can really find some help with this, okay? Talking about those negative strategies that we had, a few too many coffees in the morning, that kind of thing, these aren't going to help. They can make those bladder symptoms worse. So if just making one of those simple changes, giving it a go and just noticing that difference, I would strongly recommend it. And then that pelvic floor muscle, very, very simple, no damage can be done. Everyone can benefit from those exercises, and we know that they do help bladder symptoms or can help those bladder symptoms in some way, okay? So really important, and like any muscle, we work it as much as we can, 3 times a day, a great recommendation, pairing it with other exercises. And then where can we go for help? Okay, really important. We are putting together some resources working with the MS Society to provide information for you. So places you can also go, Continence New Zealand, a great website that has a bunch of information that you can follow along, facts, questions, answers, that sort of thing. And then if you do want to just come back to that pelvic floor stuff, there's some great resources on the Pelvic Floor First website that talk directly about the pelvic floor, those muscles, training, that kind of thing. And then who can you go to for support? Really important that you know that there are people out there that can help you, okay? Your GP, your MS nurse, physios in particular. A lot of people don't realize that physiotherapy, we can help with urinary incontinence, bladder symptoms, that kind of thing. And your continence nurse. There's also resources available that these people, if you're referred to, they can give you. For example, that can't wait card. If you're experiencing symptoms, something like this can be provided so that you don't have to queue in public and that kind of thing.
Wonderful. Thank you so much, Toni and Daniela. That was very interesting, and I think we've learned a lot as well. We've had, please feel free to either raise your hand if you'd like your microphone to be turned on, or pop questions in the chat. They are available for answering some questions. We would also note that we will send out a link of the recording after the session. And as mentioned, we are working with Toni and Daniela on some resources. If you would like to be involved, they are looking for people who might review some of these resources with lived experience. So please feel free to contact us back on that email and let us know if you would be interested in being involved in that work. And we do have an a chat message which came through. Daniela, would leaning forward mimic the hip placement recommended if a stool is unfeasible?
If you have had hip replacement, if you can, yes, that.
No, sorry, not if you've had a hip replacement. Would leaning forward while on the toilet, would that mimic the hip placement that was recommended, hip position, if a stool is unfeasible?
No, it wouldn't. It's interesting. It doesn't, because when you bend forward, your muscle, the pelvic muscle, won't relax as much as, in fact, sometimes some evidence shows that it will contract even more. So you have to elevate your hip in order to be able, the pelvic floor to be able to relax. So no, we don't do that. We don't bend forward, unfortunately.
I'll just jump in, Danny, if that's okay. If the movement is available to you, one thing that you can do is draw just one knee slightly upwards towards your chest a little bit more. And even though it's not both sides of the body, that can just aid a little bit further that effect of gravity and that relaxation.
Great, thank you. Does anyone have any further questions? Please feel either to put these into the chat or raise your hand.
That question is an interesting one, because if we think that a lot of people are experiencing what Rachel just described, we can look into alternatives and put in that resource. So how can we work around that the stool being not manageable to be used? What other techniques we can I cannot think about any other technique right now, but we can look in putting that resource if people think that would be helpful. Yes.
Well, if we have no further questions at this time, we'll close this out. We will be putting the copy of this recording onto it. Oh, we've got just a thank you. We'll be putting a copy of the recording up on our website, and we will send you, if you've registered, a link to this recording as well, where it'll be found. So I just want to thank Daniela and Toni for your time today, and thank you for sharing your expertise with us. It's very useful. Have a lovely day, everyone. Thank you very much.
Thank you all.
Thank you.